Hello, welcome. I'm so happy you joined me. I'm Maureen Pisani with ProThrive Science-Based Hypnotherapy, and today we're going to talk about something that affects most of us. Hopefully not everybody has gone through it, but I know some of you have. Surgery. Not exactly a topic we look forward to, right? Surgery has severe impact on us. Whether minimally invasive, if it's laparoscopic or keyhole, or completely invasive, it affects us. We don't want to go through it. We usually have to go through it, but I can help. And here's why I do things slightly different than most. Many lives ago, rewind the story, many lives ago, I was an X-ray technician in Malta. So let me give you a little bit of a succinct explanation. Malta is a tiny island, 9 by 17 miles, has over 500,000 people, yes, slightly crammed. And at the time I was there, they had one hospital, 1,500 bed hospital for the entire country. Yes, I was an X-ray tech there, and the easy word to express how the system worked was pandemonium. It was non-stop. Rightfully so, right? Being that when I was there weren't the specializations that we have nowadays, I was basically blessed to learn every modality: ultrasound, x-rays, cath labs, neonatal, whatever you want to say and think about x-rays and hospitals. With regards to the diagnostics, I participated. CAT scans, autopsies, been there, done that. So, between that, the detailed training to become an X-ray tech in Malta, 9 years working as an X-ray tech, life experiences, and all my training since then in the hypnotherapy world, I can help in ways most can't. Because I know the anatomy, I know the body, I know what's going to happen and how. Because I used to be the X-ray tech there, seeing it. So when it comes to preparing you for surgery, I have a technique where I do a pre-surgery according to who the surgeon is and or the location. I can do a during surgery recording, and then of course after we're going to do a post-surgery recording. So we will prepare your unconscious mind, train it, remember, identify, associate, response. So we will train your unconscious mind that as you're building up towards surgery, instead of having all those usual experiences, increased stress, increased blood pressure, increased anxiety, lack of sleep, so basically your body's depleted with worry before you make it to the surgery, which is the worst possible condition you could show up for, we prepare you in a way that you get to be happy. You get to be comfortable, you get to be relaxed, you get to be calm and peaceful in spite of the fact that tomorrow is the day. Wouldn't that be good? As you prepare it, by the way, all you do is listen to a 20-minute recording, but with us collaborating, I can find out the details, I can prepare it appropriately so it's personalized to your needs. And then when you walk in, you're calm as a cucumber. Your blood pressure is within normal limits, regardless of how nervous you expected yourself to be. I've had people ask the patient, and I find out after, right? The nurses are asking, did you take any antidepressants? Did you take anything to calm yourself down? And they're like, no, I'm fine. And the funny part is nobody realizes that the hypnotic suggestions that I've given them are now being implemented, and they're getting the results live in the moment when they need it the most. Then, if the surgeon allows, according to what the situation is, I can do a during surgery recording, which will keep everything calm: blood pressure, heart rate, oxygenation rate, pulse, breathing rate. I can minimize the blood to the location during surgery, so there's less bleeding. I can increase blood to the circulation to the site after, so we have increased healing. We can minimize bruising and swelling and elasticity of fibers. It is amazing what the unconscious mind will receive and implement once you know what to tell it. Then, as the post-surgery recording is prepared ahead of time, obviously, and all you do is listen to it and listen to it and listen to it. I don't care if you listen to it back to back on replay. It'll minimize the pain. It'll get you to relax. It'll get you to be at ease. It'll get you to be so calm that I've had people with fractured hips. Now, for a fractured hip, they jigsaw your femur. They put screws and pins with a drill. Yeah, like a Makita, whatever they are. So I want you to be in a space where, in spite of and despite the mechanical invasion that happened in your physical body, with the hypnotic tool, you get to relax, you get to minimize the pain, you get to push away the pain like it's not even yours. And that's coming from several hundreds of people that I've worked with only on pain. I've worked with thousands, and when it comes to pain, it is incredibly successful because all we need to do is teach the unconscious mind what to do with what sensation. And you get to enjoy it. So would you like to do that? Because the biggest risk in surgery is anesthesia. When your body is receiving medicines, including anesthesia, and responding in the best way possible, then you, and this is scientifically proven, by the way, this is not me, this is statistics, people need less anesthesia. When you have the post-surgery, whether it's a broken hip or a broken wrist or a back surgery, which is atrocious pain, if you have a technique that the only side effect is relaxation, you might not need all the pain meds. I'll never tell you don't take the pain meds, because in those situations you need them. But the truth of the matter is, what if you don't need them? Think of the outcome then. Think of how much better you're going to be. So come from a space where you think about it. What if? What if I'm going to be receiving all this in such a way that my recuperation is actually shorter? The person I'm thinking of with the fractured hip, according to her orthopedist, she gained full range of motion with full mobility and full agility with full strength in 50% of the time that other patients took. Because we were working systematically with the post-surgery recordings for the pain, for the range of motion, for the agility, for the strength. And it comes to the point where as soon as your unconscious mind understands what you want, it goes, oh, I know what to do then, and it does it. So here I am waiting for you. Reach out to me, prothrivesbh.com, email me, message me, I'm everywhere on all platforms. If we can work together and you get to release yourself from pain, tell me, why would you postpone that? Ready to make it happen? I'm here for you. So again, Maureen Pisani, helping the personal so the professional can succeed. I'll see you later. Bye-bye.